Welcome to Word of Mouth, where we explore the fascinating connection between your oral well-being and your health span. Here's your host, Dr. Alex Semidey.
Hello, everyone, and welcome to episode number 1 of Word of Mouth. I'm your co-host, Jeremy Wolf, and I'm joined by none other than your host. We have the man, the myth, the legend, Dr. Alex Semidey. Dr. Alex, so nice to see you, brother.
You too, Jeremy. Good to be here, man.
Yeah, man. So excited to get started here on this journey. And I thought we would start off by kind of laying the groundwork here. Why don't you tell our audience a little bit about what you do and your background, and then we shall proceed from there.
Absolutely. So a little bit about me. I'm first and foremost a husband, a father, 2 wonderful little kids, Jordy and Isabel, who are 5 and 1. And on my spare time, I keep myself busy by doing a little dentistry. So I've been a dentist in the Davie community for the last 12 years. I graduated from the University of Florida in 2010.
Go Gators.
Go Gators. Worked at a couple of offices in the South Florida area for about a year, and then decided to start, hang my shingle, so to speak, and started Semidey Dental. And it's been an amazing ride for we're about to celebrate our 12th year on the 11th of October. And it's just been a great ride, just working with amazing people. I always say I'm blessed to be the weak link in my team. We are a 2-doctor practice with a front office team, 2 hygienists, and 3 dental assistants. And from the very first phone call to the checkout, my team are just rock stars, providing an incredible experience to our patients. And it's definitely in my professional career what I am my proudest accomplishment. It's that amazing team that I get to work with every day. So we do a lot of specialty type services in the practice, from your cleaning, your preventive maintenance cleaning, to implants and Invisalign treatment and complex restorative cases like that. And we really try to take care of most people's needs under one roof, make it convenient and easy and as affordable, and try to really help people reach all of their oral health care goals, all along with, focusing on a foundation of education and helping our patients understand how the mouth works, and more importantly, how a healthy mouth translates to a healthy body, which is ultimately the reason dentists were put on this earth.
Now, is this something that dentistry you've been passionate about since? I'm trying to think. I'm going back to when I was a kid, and I think we talked about this a little bit on the Good Neighbor podcast. This idea of trepidation going to the dentist office. It's certainly for me. I wasn't going to the dentist when I was a kid getting fillings, thinking to myself like, man, I'd love to be a dentist. I'd love to be on the other side of this chair. Is this something that you had a passion for going back to when you were a kid, or did you develop that in college? When did you decide that you wanted to get into dentistry?
Yeah, so I'm always blown away by my colleagues or people in dental school that would say, I knew dentistry was the field for me since I was like 5. And I was like, how is that possible? So no, I took kind of a circuitous route to dentistry. I started college as an economics major. I thought I wanted to, go to Wall Street and be a stockbroker and all sorts of crazy ideas. And then you start learning what that reality would actually look like, and realizing that you might not be a good fit, right? So I had my quarter life crisis where, 3 years into college, I was like, I need to find myself. And I had a conversation with my mom. Thank you, Mom. One of the many reasons I'm eternally grateful to that lady. Where I expressed to her my concerns, and she threw out dentistry, she had like some cousin twice removed who was a dentist, and she said, why don't you go shadow so-and-so, see if you like it. So sure enough, I did. And to be honest with you, my initial impressions of dentistry were, okay, it's cool. You're helping people, right? You're helping people achieve aesthetic goals. You're helping people get out of pain. Like, you have a very hands-on approach to helping people with their problems, which I've always enjoyed, helping folks and working with my hands. Okay, they got some really cool gadgets. I love tools and toys, so that's always fun. And so I figured, okay, I think this might be a good career for me. Really not convinced that it was a perfect match, but basically something that I could do and earn a living. That's the honest to God truth. And you know what? It wasn't until my third year of dental school, when I was already several $100,000 in debt and 2 years into a commitment. And when I sat down with that first patient, I was like, holy smokes, like this is what I was born to do, right? There was just something, I'll never forget the procedure. This means nothing to most people listening to this, but it was an MOD amalgam on tooth number 30. And I will never forget that moment. And it was the start of my journey, my passionate journey in dentistry.
That's awesome, dude. To have that, I guess, revelation or moment where it just fell into place. And at that split second, like, I am in the right place. This was meant to be. Talk about igniting or the spark that starts your career ultimately and what you do. And it shows, brother, because as you know, I came in there recently with my daughter. She's having quite the issue with her mouth, and you were nice enough to kind of check it out and give us your thoughts and your overview. And man, you made us feel so comfortable while we were in that chair, or while she was in that chair. So yeah, doing a lot of good work over there. So Dr. Alex, what's the motivation behind this show, this podcast, Word of Mouth, right? Why are you doing this? I know you got family, you got your practice, you're a busy guy. Why are we here? What are you doing this for?
That's a multi-layered question. There's a lot to unpack there, right? Within dentistry, right? Like, my favorite thing to do is educate, is teach, is share information with my patients. As you saw, we have Google slides and presentations for all sorts of different things in the practice, so that we have visuals to help our patients understand what their current conditions are, what we can do for them, what that journey looks like. So we always take this approach of bringing information to people and making that information relevant and easy to understand, right? I think oftentimes doctors and dentists, we kind of get a little ivory tower-y-ish.
Get a little,
where
did you say Eiffel Tower-ish?
Ivory tower. We kind of get on our soapbox and we start using all of this jargon and lingo and start, trying to impress people with how much we know, and we miss the mark on making the information relatable to people. So that was really the main motivation to start the podcast, is to have the ability to bring relevant information to folks, to have conversations with other providers about how those disciplines intersect with what goes on in the mouth. The old saying, the eyes are the window to the soul. Well, really, your mouth is the window to your overall health. There are so many systemic conditions that have direct implications with what happens in the mouth, that I find that connection fascinating. And it's been the primary focus of my continuing education over the last several years to further understand how that oral and systemic connection is made. It's called the oral systemic link. And there's constantly more and more research coming out about the fascinating ways that those two worlds interact. And, shame on the profession of dentistry and medicine that we've created this separation between those two things where, you go to the doctor and he never looks in your mouth, and you go to the dentist and he's never contemplating what's going on with your overall health and how those two things interact. So exploring all of those avenues is something that I find fascinating, and something that I hope all the listeners of this podcast will too, because we're going to have a lot of really interesting conversations, tackle a lot of topics that are really kind of driving the leading edge, the cutting edge in dentistry research and overall systemic health research and health span, right? Because we not only want to grow old, we want to grow old and be able to lift up our grandkids, right? And move around and have quality of life as we age. So the intersection between oral health and health span is really my main focus, and will be the driving force of this podcast moving forward.
Yeah, man, that's good stuff, really, because most people, myself included, when it comes to going to the dentist or even the doctor, right, it's just this kind of gray area for most people. It's something that you certainly don't look forward to. And I think anything that you can do, anything that we can do to kind of lighten that experience and shed some light on the industry as a whole and talk about it in an engaging, educational, friendly manner helps people feel a little bit more comfortable, right? The next time they walk inside that door, their guard is down a little bit more, and they could have, not so challenging experiences.
Knowledge is empowering.
Yeah.
Right.
Sure.
And the more you understand how things work, you just demystify the process, and you're able to wrap your head around it. And now it's not this big, ominous, scary thing. It's something that you embrace. Right. And we see those transformations with our patients. So, really excited for future episodes.
Yeah, brother. Looking forward to it. And we'll get into some really interesting topics, no doubt. And I'm interested to learn more myself. So always a pleasure being in your presence, Dr. Alex.
Jeremy, you're the man.
Yeah. And to our listeners, thanks for tuning in. And we shall see you on the next episode of Word of Mouth.
Keep smiling.
Everyone have a wonderful day.
Thank you for joining us on Word of Mouth. Remember, a healthy smile is a reflection of your well-being. Until next time, keep smiling and caring for your dental health. We'll be back with more dental insights soon.